nice to see many familiar faces, a few new ones too. I'm Jody Wright, I'm the health coach here. And before we get to you, we have a few upcoming events. So 3 to announce exactly. Next event will be Spinal Health and Software Therapy with Cairo, Virginia. Then we'd love for you to stay tuned for the date for the open house for our new physician starting at the end of September. Dr. Obang is a lifestyle medicine physician with expertise in men's hormone health. And I will tell you, I was surprised a few years ago. I watched one of our doctors speak at a local company and I thought, gosh, this room full of executives is not going to ask any questions about men's hormone health. You would not believe. The physician had to cut them off at the end. There's a tremendous amount of interest and they were not shy. So if that's any indication of the interest that we're receiving, I think the future looks very bright as we expand knowledge here. And then October 21st, encouraging you to show up for that. That's my event, and I definitely want a full house for that. We are calling that Protein Priorities, the Secret to Living Plus Aging Strong. And moving on, so those are some things on the horizon. Our speaker tonight, however, most importantly, is Taylor Krafchick, and Taylor is a licensed acupuncturist. He received his bachelor's degree from Virginia Commonwealth University and master's in acupuncture and oriental medicine from Maryland University of Integrative Health. And may I put you on the spot and ask you, when was the day when you said, I must do acupuncture?
I actually knew I was getting into this when I was 18.
Oh.
And I'll tell you my whole story once I start.
Okay,
Yeah.
Fantastic, fantastic. It's unusual for an 18-year-old to know what they want to do the rest of their lives, so my hat's off to you for that. Taylor has extensive training and experience in using acupuncture to treat a range of conditions. First, orthopedic and pain disorders, as well as anxiety and emotional issues. And this evening, treating allergies with the Solomon auricular allergy treatment, which you are all going to learn about now. All right, thank you.
Thank you very much for the introduction. And thank you all for coming out, I appreciate it. So like she said, today I'm going to be, I treat a wide range of different disorders, pain, anxiety. Today I'm going to primarily talk about food allergies and alpha-gal. And afterward, if you have any questions about like pain or any other subjects, I'm happy to answer it. So we'll just breeze right through this and then we'll get right to questions. And now, does everyone here know what alpha-gal is? No? Okay, so I'll go over just a brief overview of that first. So it's from ticks. So basically a tick will bite a cow or a goat or some kind of livestock. It's a sugar that they take from the cattle or the livestock, and then when it bites you, it puts that sugar into you, and the sugar is alpha-gal, some very long word, but they shorten it to alpha-gal, and basically makes you allergic to red meat, dairy, anything from mammals you just get allergic to. And the only treatment is what we're going to go over today. Right now, it's the only treatment that works, and it's just one needle in the ear, and basically it helps. Well, we'll go over how it works, but it helps with that. So something with food allergies, including alpha-gal, one of the things is it really affects your quality of life. And what I hear from people, it's like people say it's controlling what I can do. I can't socialize. I have to, when I go out, I need to know where's the bathroom, or is there, because some people have that kind of reaction. And then, or it's just cross-contamination, like maybe it's not actually in your food, but they cooked it on the grill top and there happened to be, let's say, like a peanut oil or something like that, and it spreads over. So it creates a lot of stress for the person. And what I would say is, imagine if you didn't have to worry about that. If you had the food allergy and you could just go out, socialize, not have to worry about what's in your food. And So, as an introduction for me, my name's Taylor, as she already said, and one of my specialties is food allergies. And like she asked, how would a random 18-year-old just want to get into acupuncture? So, a little bit about me, how I got into acupuncture was I used to have epilepsy, and when I was younger, like, I understand what people go through when they're dealing with medical conditions, because when I was younger, doctors, they just kind of like passed me around. They're like, oh, like try this new technique, try this medication, try this new ketogenic diet, brain surgeries, like you name it, like I did it. And at that time, nothing worked. And then I tried acupuncture, and it spaced out my seizures pretty dramatically for me. Like, it's probably not going to sound like a big deal, but I think I was able to go like 2 months and then just have one seizure, and then I go another 2 months and have one seizure, where I was having just like 10 seizures a week or something, tons of seizures. And I'm not having those anymore, so so that's good. But that's how I got into acupuncture, and I decided, I was like, you know, acupuncture helped me space out the seizures a little bit. I'm sure I'd like to help other people with things that maybe medication's not touching or the surgeries aren't the best option. So that's how I got into this. And some of the things we'll go over today is basically what's happening in the body when you have food allergies, how to know if the SAT treatment is a good option, and just some case studies of my personal patients. So we'll go over their results. So with food allergies, really the only thing that right now people can offer, it just like if you have the peanut allergy or whatever the food is, it's just like, all right, well, don't eat peanuts, just avoid it. But that's not really much of a solution, and it doesn't really address the actual underlying issue. You're just avoiding it, and it's kind of causing, again, stress, because you're worrying about things like, do I avoid it? Do I need to carry the EpiPen? Kind of like it says here in this picture. I guess you can't really see it too good, but it says, it's from a parent, and it says, they said, here's an EpiPen, just avoid the foods, good luck. And that's kind of the solution. But the problem with that is then you're avoiding all the restaurants, socializing, and then you're just kind of missing out on life a little bit. And another common complaint I hear from my food allergy patients is it's just exhausting, because you're having to read labels, you're having to tell the waiter every time you go out of like, here's the allergy list, make sure it's not in there, and somehow it always ends up in there when you order out. And then also, like I said before, like you kind of have to know where's the bathroom, because a lot of people have that reaction. So it's just, it can be mentally exhausting. And then we already went over how avoidance is kind of the main way to not get the food allergy. Some of my patients here, the different allergies. Christina, she's a great woman. She came to me, she had dairy allergies, an egg, and a couple other things, but those were the main ones. Although one of them was chocolate, so she would probably say that was main. But the bigger ones were the dairy and egg. And she was one who needed to know where the bathroom was at all times. Like if she had any dairy, rush would go right through her. And then she recently told me, like a few months ago, we did the treatment, and she came back and was like, I went out and had an omelet for the first time. She was fine. She had ice cream. She can eat all the dairy and egg that she wants now. And all just from one needle in the ear from acupuncture. And another one of my patients, Mike, he had alpha-gal. He was having tongue swelling and itchiness and some GI issues as well. And then same thing, we did the treatment. He's able to integrate now the red meat back in his diet, all the dairy and anything that had the alpha-gal sugar in it that was irritating him. And then again, nut allergy, same kind of thing. She was able to integrate that back in and not have the reactions. So instead of avoidance, what if we were able to just regulate the nervous system better, as well as the immune system? Because what we don't want is, when you have a reaction to the allergy, is to have a heightened immune system and an overactive or overreactive immune system that you see, like the body sees that the allergen in you, and then it overreacts and you get your symptoms. So with the SAT acupuncture protocol, basically that's exactly what we're doing, is we're calming down the nervous system and we're lowering that immune system response. So we're basically allowing you to eat the allergen, and then what it does, it's essentially retraining your body and your immune system to just not respond to that, and it puts the allergy in remission for you. It's very effective. It's 96% effective, but can't guarantee it for everyone, but it's a high number for sure, and I had great results with it. And I have a picture of the ear here because what it is it's just one tiny needle in the ear. And I have the needle with me. I can show you guys after, but it's like almost microscopic. It's really tiny, and it stays in for 3 weeks. And you just put a little bandage over it, like in this picture. Well, there is a bandage right here, but you can't really see it. So you just put a bandage over it and then keep it dry for 3 weeks. You don't eat the allergen. So if it's alpha-gal, you stay away from all the red meat, dairy, and any other mammal products. It can even be things you don't think of, like lotions and shampoos. They sneak those like mammal collagens in there, and you get the itchiness of the reaction. But basically, we find an area of the ear. So the doctor who developed this basically was able to determine that all your allergies come from your liver. And he found a spot in the ear that corresponds to your liver when he was doing electroacupuncture in the ear. And on the liver, he could see that it was lighting up in that area with, like, when you're reading the the physical vibrations of the ear. And then, so what we do is I'll show you. I have a bunch of vials with all different allergens in it. So I've got like tomatoes, all the meats, dairy, all the common ones. And then I would have you hold the vial, and then I'm gonna muscle test you. So if anyone here has an allergy, I'd love to test you if you want after I talk. But so basically we're gonna see if it causes a reaction to you. It's just a muscle test, and if you have the allergy, it will just make you weaker essentially. And then I'll take this device here, and it's kind of like a metal detector, where basically it's not putting any electricity into you, but I'm going to go around the area of the ear that he corresponds to the liver, and when you're holding the vial and it's picking up that vibration, this is going to pick up the area of the ear that corresponds to the allergen, and it'll start just beeping. So it's kind of like a metal detector. And then you put a needle there, and I would muscle test you again, and what happens is all of a sudden you're stronger because the needle's propping you up, and it's basically saying don't respond to this right now. It's pretty cool, and it's very effective. And like I said, we're calming down the nervous system, putting it into remission essentially, and after 3 weeks, it allows you to be more confident and just less mentally consumed and worried about consuming the foods that were bothering you, and it just essentially desensitizes you and allows you to not overreact. And as a few examples, like I have some patients who were having like severe allergies and like anaphylactic shock kind of thing, and then now maybe they just have like a small rash that shows up. So it like a lot of times it gets rid of it completely. Like for the woman Christina, that she's able to eat anything, doesn't cause any problems. But some people it just like takes it down on a level so they're able to live their life more freely. And that's the good news, is that you don't have to settle for just avoidance or carrying an EpiPen on you all the time, because we can do this treatment and you don't have to worry about the reaction anymore. Now, a couple more case studies that I have for you is here's one of my patients, Brandon. He had another dairy allergy, and he would have asthma fits when he ate any kind of dairy product, and also other things, just like having to go to the bathroom from it. But he was able, we did the treatment and he no longer has the asthma issue anymore when he eats the dairy. And then this person had a gluten allergy. The doctor had diagnosed her with celiacs, but it turned out that it was just an allergy, which is kind of common because our gluten is so unhealthy. Like it has like a lot of these like the pesticides on it, and it's just not the healthiest. That's why you can often go to like Europe and be fine with it. But we were able to do it for the gluten allergy, and she was able to integrate bread and everything like that back in. And then I had Peyton, who, again, an alpha-gal patient, who she was worried about being around all kinds of food and eating out. And because, like I said, the cross-contamination is always like a fear, and she had a big fear of that. And she was grateful because now she was able to go eat out and not only integrate that food back in, but also not have to worry about the exposure from other people's meals. So that's pretty much it for my talk, I believe. And does anyone have a food allergy that would be like to be tested? What do you have? Or
I have lactose intolerance.
Okay.
Every time I drink milk straight, it gives me a lot of gases and upset stomach.
Sure. I can test you for that. What did you have?
I think I'm allergic to onions because when I eat a raw onion, I have a bad taste in my mouth and it's just a bitterness and I can't get rid of it.
Okay. I don't
So
have
I think
onions
that
here
is
to
an
test you with, unfortunately.
Garlic?
Garlic too?
Maybe. I might be. Do you have garlic?
I don't. That's something where, like, for instance, I had someone yesterday who was allergic to rice, but I didn't have rice in one of my vials. So she just brought the rice into my office, and we just tested her with her holding the rice, and it's just as effective. What did you have?
Chocolate.
I
Isn't
do
that
have chocolate.
Chocolate. That's terrible. Yeah.
I do have that one.
I couldn't, I felt like my throat was closing in and it was very scary.
Mhm.
Yes.
So I can start with you with chocolate, and then I'll do the lactose with you in a second. Do you want to come up here and do a test, or?
Question.
Yeah.
What is SAAT?
So that's a Solomon auricular acupuncture therapy. I think that's what it stands for. So Dr. Solomon is who came up with it. He was the one who found that area of the ear.
Auricular meaning ear?
Ear, yeah.
Acupuncture technique?
I think that's what it is, or therapy,
Okay.
something like that, yeah.
I'm not getting any needles stuck in me right now.
No. And this is the
You
needle.
just hold the
I have the needle here where it's like, it's so
Oh,
tiny,
It's so tiny.
they
I've
don't-
done
Yeah.
acupuncture.
but it's not even like that.
Feel it.
This one's even smaller.
That's
I
what they say
think.
at the dermatologist. Oh, you won't
No,
feel it.
no, it really doesn't.
You said
Looks
chocolate,
like a-
right?
Yes.
So basically I have this little contraption where I'm gonna take the chocolate vial, which has the printed frequency of chocolate in it. And where's my chocolate? Oh, here it is. So I'm gonna put it in here, and I'm gonna have her hold this, and it's gonna basically transfer the frequency of chocolate into her, and then we'll muscle test her to see if there's any difference, to see if she's
I'd like
allergic.
to make a liar out of me, but I really did have that reaction. It was really,
Okay.
it was,
So stand up straight for me and just look at me, and I have you put your right arm out and push up as hard as you can and try and resist me. Okay. So I couldn't, you were too strong for me, and as most people are if you're resisting. So now hold that with your left hand and just put a little more in, and then put your right hand out like we just did. And now resist me now as hard as you can.
oh,
Are you trying? Or?
no, I have a bad shoulder, so.
Oh, do you want to do the other one? Or?
Yes, let's do the other
Okay.
shoulder.
Let's do the
Screwed
test
up the
over
whole
here.
thing
No, you're
already.
good. So push up. So strong, and now hold it with this hand now. And push up as hard as you can. So just like that, that would be like a confirmation of I can treat you for the allergy now.
Oh, I wasn't
And-
trying. I mean.
You weren't?
I
Or-
mean, I wasn't making my arm go down on purpose. I was really trying to.
Oh yeah, exactly. And
Pitiful.
then what I'll do is I can just do the whole thing if you want. If you hold this with this hand, just the handle there.
Am I still holding this?
Yep. So basically now it's transferring the frequency in, and now I'm going to. Don't make me look bad. So now I'm going to look for an area in her ear, and it'll start beeping when we get there.
Oh, wow.
So like that would be the area that we would put the needle, and then we would leave it there for 3 weeks.
Well, so you found a
And then-
spot.
Yeah, did you hear it?
Oh,
Or-
yes, I did.
Oh, yeah.
It's either that or
Maybe
she's
grab this.
radioactive.
So that's kind of how it works. And then the needle, where'd I put that? Needle's right here. If you want, you guys can like pass it around or something. But there's 5 of them in there, really tiny, and just stays in your ear 3 weeks and retrains the body not to respond to it anymore.
So that was showing I am allergic to chocolate.
I would say so.
Yeah, I've been that way since I was 12, but I try to sneak it in now and then, and clearly I can't do that.
What happens? You said your throat?
Oh, yes, I was reaching for a Benadryl to try to relax it, yes. It swelled up and I couldn't swallow, and I'm sitting in the kitchen, I'm trying to drink water, and it's like, and coming out of my mouth, so it was,
That's not good.
yeah. Probably
Well, yeah, you
some-
should come and we'll get you to eating chocolate again.
Man, that was really,
How
Loud.
many treatments
Fiber.
does it take? Just one?
Oh, it's just one. It's a one-time treatment.
And how do you take a shower with that thing?
Yeah,
It's a band.
that's the hardest part of this.
Okay.
Is so I do have a shower cap that I'll give you. It's like a shower cap for your ear.
Oh, okay, just put it, I
yeah.
was wondering if you had something.
It's like a mini one. You just kind of put it over your ear, and then you just reuse it for the 3 weeks. And then what I've told people, because some people call me and are like, you know what, it fell off and went down the drain. So I tell people like just hold it, maybe hold the shower cap on it, because you want to keep it as dry as possible.
Right.
But yeah, that is the biggest challenge. And I've had a couple people lately, thanks. I've had a couple people lately like come in for the allergy treatment, and they say, all right, I'm going to Myrtle Beach this weekend. And I'm like, well, yeah, you can't swim. And there's like, oh, like, I guess I need to come back after again. And like one guy jumped in a pool right after we did it, and he called me and said, hey, it's out. I was like, I know, I told you not to go swimming. But yeah, that's probably the biggest obstacle, but it's just kind of a do your best. It's also like, unconsciously, you might just scratch your ear. I had a girl the other day call me. I had to redo it on her like 3 times, because like during the night she went in and just like scraped it out and just was sleep during her sleep. But most people are okay with it.
so is it internal? I mean, does it stick out any, or how?
No,
far and-
did you see how small it was, or?
Yeah.
Yeah, so
You
it's
tape it.
it's just like right under the skin. It's not going deep at all, because it's also just like cartilage, so it's not like we're going through much there. But it's very superficial.
Oh.
What about things like penicillin or bee stings?
Yeah, I would think the penicillin I could probably help with.
Okay.
The bee sting, I'm not sure about that.
All right.
I would think I could order like the bee venom
Mm-hmm.
from the company that makes
And
these.
then find out.
And then,
Okay.
yeah, exactly. It'd be
Okay.
something I'd have to order.
What was the question? We didn't hear it.
She asked about bee stings, and what was the other one?
Penicillin.
Penicillin.
Yeah.
Yep. And did you want me to test your
Yes.
license? Yeah.
This is for lactose intolerance.
Yeah, and that is different than an allergy. So we'll see.
Yes.
Like sometimes that's like, yes, it's an allergy. Sometimes it's just like an intolerance, and that's totally different. Go ahead and put your right arm up, or yeah, that one too.
Right?
It doesn't matter, whichever one you want to put up. And just resist me. Okay. Now hold it with this hand and push up.
Oh,
No? Yeah.
It's an allergy.
now you know.
So I would say definitely that would be something I would treat actually, yeah.
And the same thing, you just,
Same thing like we just did, we would just take it throughout the ear, it would start beeping when it hits the spot and put a needle there.
what's the logical reason for that?
Yeah, basically, what do you mean, like for why it's beeping?
The what?
Like why it's picking up on something, is that what you mean?
No, I mean, why do these things are connected? I mean, Why is it the ear? What, I mean, what's the science behind it? What's the,
It was the liver, you said.
Yeah, so it's an area of the ear. So the ear is actually well known for like you can treat the whole body with it. But like the science is that I guess basically it's retraining your immune system to not respond to it. But and also I'm not exactly sure what you're asking, but it's like with these, it's picking up on like the frequency of that, like when I'm moving around your ear, and that's how we know it's like specifically for that allergen. Because like if you come in with a lactose and then a chocolate allergen, it's going to be in different areas of the ear as well, because it's going to be like a different area of the liver that's going to be responsible for it. But yeah, basically, like I said about the Dr. Solomon who developed it, he did training, or he did like a lot of studying of like that area of the ear, basically where the liver shows up in the ear, and to see like where in the brain would light up when you stimulate certain areas. And he was able to pinpoint an area for the liver, and that's how he kind of developed it.
I've got another question. I don't want
Sure.
to waste time. I got high blood pressure,
Mhm.
and I take medication for that.
Yep.
Does acupuncture help to control, lower my blood pressure? Is
It'll
it,
definitely lower your blood pressure, like right after the treatment for sure. What?
how come? How does it do it?
Oh, it's going to relax your whole body, relax your nervous system, and allow your blood vessels to, it's just going to relax everything in your body. But also, what you would really need for that is herbal medicine, because it'll last for, like if you do an acupuncture treatment, everyone kind of gets that relaxation and the like lower blood pressure effect. But after like just one acupuncture treatment, it's not just gonna be like, oh, like you're good to go, you get off your medicine now. You would need more of an ongoing herbal medicine, because this is coming from within and it's coming from more of an organ issue. And so that's where you would need the medicine to go in and help correct whatever issue. So like, I don't know your specific case, but a lot of times like maybe there's, let's just say, too much inflammation in an area of the body that's causing the high blood pressure. We would give you herbs to basically promote the release of that inflammation and cool off your body a little bit. But that's just a general, basically, description of it. But yeah, I would say that'd be more of an herbal thing. For sure. Yeah.
Do you only do one at a time, or say you had milk and chocolate?
You can do them both. I
And you
did
would
today,
do-
I did,
okay.
in one person's ear, I did like maybe 3, and then yesterday I did someone, we did like 6 at one time.
Whoa. Okay, okay.
So when you do that with the chocolate
Mhm.
thing, would that cure me of being allergic to chocolate, or could I eat it again?
I would never use that word, cure or anything, but
I was trying to find a word, and that's why I wanted to call it.
yeah, for most people, you're able to start reintroducing it, and it should last many years to a lifetime. It's not like a thing where it's like you're good for this week, and then you come back next week, we do it again, and then you're good for another week, and then we do it again. It should last many years, the rest of your life, basically.
I mean, who's allergic to chocolate?
Well, I told you that girl was in there
I
too.
haven't read it, but it used to give me a headache.
Oh, thank you.
Yeah.
I'm sorry, I'm taking too many, asking too many
If anyone else has
questions.
questions, raise your hand.
Yeah, I got another problem. I got a prostate problem.
Mm-hmm.
Would that help as well? Does the acupuncture help?
That would again be an herbal thing, probably 100% herbs, and I would say that I'm
Not
guessing.
acupuncture.
No, not in the ear. So yeah, we're talking more full body acupuncture now. The ear I primarily just use for the allergies, but for everything else I put needles all over the place. But I would say that wouldn't be something that I would feel comfortable taking on myself.
You can do it?
No, like a prostate issue, I would say probably wouldn't take on that. Like, I don't think it would be too effective. Yeah.
If you have someone come in who says that their labs lean, like they have, what am I trying to use the word earlier? I just lost it. Inflammatory condition, or not, autoimmune, that's it.
Oh, yeah.
If someone comes in and say their labs lean autoimmune, but they've never been diagnosed with any specific autoimmune condition, is that a person you can treat?
Yeah.
Or what would your approach be?
Yeah, I mean, like people come to me all the time. They don't necessarily have like diagnosis from a doctor or anything. It's they just are having symptoms, or they maybe think that they have some kind of autoimmune, and at that point it's almost like they're correcting it early probably, and we're able to address it quicker. But yeah, that's not a problem.
Could you treat Hashimoto's? Because that's an autoimmune.
Yeah, that is something that,
Because I just got diagnosed with that. Of course, I've had it and it was overlooked for many years.
right. That's so these kinds of things, they're definitely going to require herbal medicine for sure.
And what if the person reacts to herbal medicine?
Most
Are there
people
other-
don't.
I react to herbs.
Do
I'm
you?
very super sensitive. I react to drugs, I react to herbs. Homeopathic is really good for me.
Okay, and that's kind of what this basically is homeopathic.
So,
With
but
the herbs, what happens? Is it like a diarrhea kind of thing?
Headaches,
Or? Okay.
sometimes. It's really weird. My body's strange.
All of our bodies are strange. I would say, like, if you wouldn't be able to take the herbs, then I probably wouldn't be able to treat it with just acupuncture. So like,
Right.
acupuncture is really good at musculoskeletal stuff. Where like if you just have shoulder pain, I can muscle test you really quick, and it's all about moving blood. So like just put some needles in different areas and move blood up to the shoulder, and you're gonna be feeling better pretty quickly. And it can help with other things as well. But when the organs get involved, you need to have some kind of internal
Right.
thing going on.
Well, I'm wondering if you could, if I'm so drug sensitive, that's kind of an allergy that you could treat.
Maybe.
Yeah.
Tuberculosis?
No, I won't be able to reverse
I think
that.
so,
Yeah.
That was
But it's a good question.
dreaming.
Yeah,
I'm just curious.
absolutely.
I'm a guy who always question things.
Of course.
Why would the herbal medicine, would be your suggestion instead of this pharmaceutical medicine? I mean,
Well-
what's the difference? What's the
First of all, I'm not saying
disadvantage?
that's my suggestion where it's like don't do that or
No,
anything
no, no.
like
What
that.
I'm saying, I mean, what is the pro? What is the
Yeah, I can answer that. So basically the pro I would say is, first of all, they're just plants, so it's just more natural from the earth, and there's not going to be side effects. Normally we're using the whole plant. If there is a reaction, usually it means that it's the wrong formula for you, and that's what your body's like rejecting it almost, like it would give you diarrhea and then you would just stop it. But also we're treating the root cause of why you're having the blood pressure. We're not just like giving you a medicine that will adjust the symptom of, like, you have high blood pressure, you're gonna know better how these medications work, but it's like maybe it'll relax vasodilate the blood vessels, so you have the blood pressure goes down, where but then also like you might get side effects from it, you might get something else. So that would be the pro, I would say.
I've done some research on some other medication, like
Yeah.
for example, the digoxin is actually digitalis. It is a plant.
Mhm.
But the thing is that the way I understand it, that if it's a plant, it is not quantitative as the medicine is. It has, let's say, 5 milligram, 10 milligram, let's say 15. It's more of a pattern, and whereas the
So it's more, you're saying it's more concentrated, right?
What?
It's more concentrated in
concentrate and
yeah.
more
Standard.
more identified, rather than, like for example, I make my coffee, sometimes it's too strong, it's too weak, add more water,
Yeah, because a lot of medications are from plants. Like there's a well-known Chinese medicine formula that helps with sleep, but it's the combination of all those plants together that's creating the synergistic effect in your body to help you with the sleep, and then also not get any side effects, because there's going to be like one plant in there that maybe does a certain thing, but there's another plant in there that counteracts that to make sure it doesn't get any side effects. And there's like thousands of compounds in these plants, where a lot of medicines, like they look like this formula I'm talking about, they'll look into like the specific seed and like what's the compound in that seed that they can extract and just replicate into a medicine, and then that's when you end up getting side effects. And because it's taking out all the other thousands of compounds that are in the whole plant that are supposed to be in that formula
Well,
to
I
help
would
you.
think because it's synthesized, it's not really the true plant.
No, it's not, yeah.
So,
It's,
you have all
it's
these
lab grown.
excipients when the drug companies do that react also.
Absolutely, yeah. And
I
that's-
worked for a pharmaceutical company, that's why I'm so anti-drug, but.
Well, and the plants can't be patented.
No, and they can't
And
be
the minute you
synthesized.
can't patent it, then.
No, but you can't synthesize what nature.
Yeah, and that's a
Exactly.
that's a good point, like, it's just a
Yeah.
lab grown kind of thing
Mhm.
where it's not actually the plant, you know? Any other questions, or yeah?
I was just going to, I've been doing acupuncture, oh gosh, 30 years or so, various different things, but I got hit with MS
Mm.
like 15 years ago, and I went to an acupuncturist, and I can't think of her name, I was gonna ask you, but those first 3 years, it really helped me because I had an incredible amount of pain, and it just tamped it down
Yeah,
so that I could continue working, and it helped a great deal.
yeah, I appreciate that, yeah, with
Mhm.
MS, that's something, I can help manage it.
Yeah.
Can't reverse it, cause it's gonna do what it's gonna do, but,
Yeah.
it can help manage it so
Mhm.
you can have the active lifestyle essentially.
Can you help GERD?
GERD, yeah,
Okay.
mhm,
Ooh. Yeah.
yeah.
When I was young, I had a surgery, I had appendectomy,
Okay,
and I took erythromycin, and I developed skin rash. Is there a remedy for that? Because everywhere I go, I write down I am allergic to erythromycin. And I wonder, is it one time happened in 1970, or is it I still have it, or what? I mean, is there a test for it?
I wouldn't know the answer to that.
But there's no test for erythromycin.
That's like a Z-Pack you're talking about, right?
Sorry?
Like a,
It's an antibiotic.
yeah, that's what I thought you were talking about. Yeah, I don't know the answer to that. Maybe, do you know that, or?
I would be very careful if you have an anaphylactic reaction to anything. In medicine, the principle is that you don't re-challenge yourself with that. So I was going to ask you later about that. You said a 96% success rate,
Mhm.
and I'm not here to like sandbag you. I had
It's all good.
acupuncture work for my
Mhm.
pain, but I'd be very hesitant to tell a patient, hey, if you had anaphylaxis, you need an EpiPen. Go take this thing you're allergic to, because going by your statistics, there's 4% of people who would have an anaphylactic reaction.
Yeah, I never tell people if they're at that severe, I always tell them to
I'd
be
very-
cautious and always have the EpiPen on you.
Because even in medicine, if we send you to the pulmonologist, they're gonna monitor you. If they're desensitizing you to something and monitor you for a good period of time to make sure you do not have this reaction when you leave and you're on your own. So again, I'm not trying to do that, but just as a physician, I would be very hesitant to, if I'm, it's like you said, there's a difference between, excuse me, intolerance to something and anaphylaxis, because your body has memory. You have antibodies that resurface because you're exposed to that again, and that's why you have the allergic reaction. The other thing was the plants. I mean, I know all natural doesn't mean you can have a reaction. You can
No.
push up some poison ivy and eat it.
For sure.
You're gonna have a reaction to it, not because it's not good just because it's a plant.
No, I agree with that.
Yeah.
Plants are poison too.
No, I
Yes,
agree
I-
with that, I
Yeah.
do agree
Yeah.
with that. They're pretty
I remember
cool.
that.
So again, I just, as a physician, I felt we need to speak on that. So,
Yeah.
again,
No, that's all good.
okay.
Yeah, and most of my patients, like with the anaphylactic, like especially with alpha-gal, most people aren't getting that level with the alpha-gal allergy, and like most people are getting rashes or digestive issues and things like that. But if someone does have that kind of reaction, I always tell them like, yeah, we can do the treatment, but you still have to be careful and just see what happens. But have your EpiPen still.
My youngest daughter, she had the Lyme disease.
Mhm.
She had a tick because, so the way she was told, actually she lost about around 20, 30 pounds. I mean, she looked so sick for a couple of years. They did not diagnose in the beginning she had a Lyme disease. But she was told that this is gonna be with her the rest of her life. Is that true?
I mean, I think for a lot of people, yeah. I don't particularly treat a lot of Lyme. I haven't had good success with it. It's very hard to treat because it kind of hides and mimics other things as well. But that's another one, kind of like you mentioned, where like if you have pain, I can help manage those symptoms.
Yeah.
But that's a tricky one to treat, at least from my experience. Yeah.
She was sick for a long time, and the thing is that they didn't identify that in the beginning, you know.
The testing was very bad for that.
Yeah,
When I
for
first
Lyme.
got the
How is
MS,
she now?
it was very bad
Well, she's
testing.
now 32,
But now
33,
it's
but
much
she
better.
was 18 years old
Yeah.
when she had it. I don't know, she went out somewhere. You know.
Do you have any experience with lupus?
Lupus, like what kind of, I guess, I probably wouldn't be able to reverse it, but that's another one where I could help manage those symptoms. So it just depends on what symptoms the person would be having.
I just have a friend who's going through a lot with that.
Mm-hmm.
Thought I would suggest it to him.
Yeah, it's certainly something that can potentially help. It just depends what are the symptoms. I'm probably not gonna be able to get it so that she could be like, hey, I don't have lupus anymore.
Yeah, I understand.
But it can help manage the symptom, kind of like we were talking about.
Super helps with the pain.
Do
Mhm.
you have a card? I have a neighbor
Yeah,
that has a
I
little
left
boy
a
that's.
bunch over there on that
allergic to
table, actually.
everything. Oh, super.
Thank you.
Thank you. Her little boy goes for allergy testing every week, and you can't eat this and can't eat that. It's like,
Yeah,
she
and
should've
it
been
may
here
help.
today. Oh, yeah, look at this.
Yeah.
It's 10
I
years
asked
old.
you previously, I have Medicare and I have Anthem Plan F, and you said it doesn't cover that.
Yeah, so,
How much should I expect these sessions will cost me out of pocket? Just curious.
Right, so I'll answer the insurance question first. So, because everyone wasn't here when you asked that. So at my office, I accept Humana. So if you have Humana, you can come to my office and they'll cover back pain, like low back pain. And, but that doesn't mean that, like if you happen to have that, it doesn't mean that like if you have neck pain, I can't treat it. It just means that you have to have back pain as well, and we can treat them both. But so for acupuncture treatment, like a regular one, I charge $85 per treatment, and
How
then
much?
85, and then for the SAT treatment, it's $280, and it's just a one-time treatment. But yeah,
What is it, 284, sorry again? I didn't-
$280 for the ear treatment that we were talking about
The ear,
there.
okay.
Yeah.
But if you're doing multiples, isn't it only like 50 more? or something?
Yeah, so if you had, so she said if there's multiple allergens, is it like a different price? So like the first needle, or the first allergen is $280, and then if you also, let's say you have alpha-gal and you also have a chocolate allergy, we could do both of them and it's an additional $50 per allergen. Yep. But yeah, a lot of insurances, so it is in Medicare now, but there's so many hoops to jump through, and they're making it pretty hard to actually use that benefit. So right now, insurance really doesn't cover much. Any other questions? Great.
All right.
Thank you.
Yeah.